2 weeks after my mastectomy. So I was able to go back to my reconstructive surgeon. Um, Fortunately and unfortunately. So fortunately, my drain coming from my axilla or my armpit region is good. So we were able to take that out. But the drain coming from my chest, it's still a little bit high. It's more than 50 for, the whole duration of 24 hours. So hopefully, we will be able to cut down on that in the next week. So we'll meet again next Tuesday so that we should be able to hopefully take out my drain. So yeah, and then after lunch, we actually also waited for my oncologist. So I have a lot of paperwork coming from her. So yeah, coming from my results of the biopsy coming from my surgery. So I am breast cancer 2A. I am estrogen and progesterone positive, but HER2 negative. And then my the lump, which is nearest my right nipple, didn't increase in size. It's only 6 millimeters, not centimeters, but millimeters. And then for my lymph node, it's 1 out of 19 that tested positive. So it's able to go through treatment plans that we will be looking at. Definitely, we will go through hormonal therapy. But hormonal therapy will only happen post chemotherapy, or again, there's like 2 subsets of what's going to happen when it comes to chemotherapy. I do have 2 options. One option is to have my genes tested. One is to do a mamma print or an oncotype. However, both of these are just tests. I mean, there are some patients who doesn't like getting the idea of getting chemo. But yeah, it's costly. The test will be sent out of the country. Most likely will take around 2 to 3 weeks, close to a month, for you to get the results. But again, even if, like, let's say the possibilities from that test, if the test results come back and the results is still showing low risk, for me, that is still a risk. So that's option 1. Option 2 is going straight to chemotherapy, but because the size of my lump and all the rest of the clinical diagnosis, all that stuff, we're just looking at having 4 cycles, which is pretty good. So chemo can happen every 3 weeks, but before each cycle, I need to get a lot of laboratory work done 1 to 2 days prior to the session, because if that doesn't look good, you can't do your cycle. So yeah. And then after that umbrella about chemotherapy is done, the other piece is hormonal therapy, which will be done for the next 5 years. But on top of that, after the chemo, I will still be referred over to a radio oncologist, so that we should be able to try to see what are their thoughts if I still have to do radiation therapy. So yeah, But for now, I really have to think about what I want to do. Do I want to do the mama print or the oncotype? Or do I go to the direction of going straight to the four cycles of chemo? Nevertheless, I do have already like the blood work that I need to do if I go to that direction of doing chemo. And I also do have the medical protocol already coming from my doctor that I just need to endorse over to the infusion team. But I still have to look at costing, of course. So because we would be needing to know how much it will cost, because I wouldn't know, right? And there's this one medicine, I think it's a steroid, dexamethasone. So I have to drink 2 tablets of it after breakfast and also after dinner for 3 days, starting 1 day before chemo. And a friendly reminder coming from my uncle that if I do not do that, we cannot push through with a chemo session. So, really have to take the dexamethasone because it's more to address if you have like any allergic reaction to the chemo drug or the nausea and whatnot. So yeah, we will decide this week.